member with Empty Frames Initiative, and in my day job, I work as an integrated primary care behavioral health consultant in a community health center. So community health centers are one of the healthcare agencies on the front line of fighting the COVID pandemic. And folks have asked me what I'm doing to stay healthy, so I thought I would share my personal things with you, but also some of the recommendations. So for me, a routine is the most helpful thing, a routine that includes getting good sleep and eating regularly. I've increased my food intake of antiviral foods and plants. If you're interested in that, you can Google and find out more. I only go where necessary. So in the past 3 weeks, besides work, I have been to the doctor's office, CVS pharmacy, and to the store twice. I don't anticipate going to the store for another 3 or 4 weeks. So, you know, only absolutely necessary places. I'm not spending time with friends or family right now. When I am out, I avoid touching public surfaces. So putting your sleeve over the, handle to the door. And don't touch your face when you're out. I know we've heard this, but specifically, do not touch your eyes, don't pick your nose, don't, eat Cheetos with your hands. Avoiding those mucous membranes is what's most important. And when I come home, I wash my hands immediately. That's just part of working in healthcare. I've always done that, but I'm give it extra tender love and care now. So, sing your ABCs. And sometimes I take a full shower. So, the day I went to my doctor's appointment, I came home and just took a shower. I also blow my nose into a tissue when I come home, because the great thing about our mucous membranes is they can catch bacteria and viruses and hold them there. So blowing it out and then not reusing the tissue to blow further, but getting a new one. I also gargle with salt water to, rinse my mouth out when I've come home. Because the great thing about our immune system is you can ingest a few particles and still be okay. It's not one particle gets in and you're doomed. We have a great immune system, so reducing the number that could be in there, it can also be helpful. So I also wear a mask when I go out in public. I know not everyone has access to masks, and I know there's some discrepancy about whether they're helpful. For me, that's a preference of mine. If you don't have a mask, you can put a handkerchief over your face. Make sure it covers your nose, the sides of your face, and here, sealing off this part is imperative. So if you don't have a mask, you can use fabric. So that's what I do personally. So I wanted to tell you a little bit about supportive care at home for COVID. So the difference between it's been a long day. The difference between a viral and a bacterial infection is that bacterial infections can be treated with antibiotics. The treatment for viral infections is what we call supportive care. So things like the flu, things like COVID, even if you go to the doctor, unless you are in acute condition, they're gonna give you supportive care measures. So I'm gonna talk about some supportive care measures related to COVID. So monitoring vitals, monitoring your vital signs. So what that means is taking your temperature, your blood pressure, and your oxygen level, and watching those for dramatic changes. So increase in temperature, increase or drastic decrease in blood pressure. What we're looking for in COVID is a drop in your oxygen saturation. So those little things they sell that you can put on your finger, that measures your oxygen. Staying hydrated and nourished is really important for your body to fight any infection. I know none of us drink enough water even regularly, but now is the time to be drinking water. Using medicines to reduce fever. I know there's been some discrepancy out there about ibuprofen, but Tylenol or acetaminophen is just as effective as at reducing fever. So stick with that if that's what you prefer. Rest. is so important. Staying away from others, certainly if you have any symptoms, you know, stay away from others. And before you see a doctor, call and make sure they are able to see you for your symptoms. What I'm seeing is a lot of emergency rooms or emergency departments, people are going there and being turned away. So what that means is, you know, if this person has COVID, then they've, you know, traveled to a public place and potentially, you know, spread the virus further. So call. It also gives your healthcare provider heads up so that they can have things ready when you get there, to reduce further exposure to you if you don't have the virus, and then if you do, you know, reducing exposure to others. So, but hopefully it doesn't come to that. The CDC, or the World Health Organization, has put out some guidelines about how to take care of COVID at home in mild cases. So I will have them posted below if I can figure out that. So hopefully it doesn't come to that. So let's talk a little bit about prevention. So the biggest preventative measure we can take is staying home. I know we've heard this, but they really mean it. And the reason is, if tomorrow everybody stayed home, we would continue to see cases rise for the next month. And that's because of the incubation period and the spread within households. So the charge to stay home includes young folks as well. There's some information coming out of, you know, them being carriers and increasing prevalence rates. We also have, I believe, a social and moral responsibility to care for the least of us. So that means, you know, folks who can't fight off the infection as well. And we do that by staying home. I wanted to talk a little bit more about hand washing, and please remember that soap and warm water is still the most effective thing. I know everybody bought up the Purell, but soap and water is better. If you are using hand sanitizer, make sure it's 60% alcohol. The other preventative measures are things that I talked about in my daily routine, but avoiding contact with your mucous membranes, avoid using your phone in public, cleaning it routinely, especially after coming home. If you're immunocompromised, consider wearing a mask or covering your face in public. Disinfect surfaces routinely. You can use a diluted bleach mixture. If you don't have any bleach, soap and water is good. And remember that physical distance doesn't mean social distance. So unfortunately, we can't hug each other right now in a time where we could really use a hug. But me and my colleagues at work have been giving air hugs, I love yous. So staying connected during this time. And I'm gonna do another video about mental health management during this time. So I hope that you'll check that out.